Today, I would like to introduce a very interesting and challenging clinical case. In particular, immediate extraction and immediate implantation of the canine area is a difficult part for many clinicians. I will show you a case where the socket shield technique was used to leave the residual root after extracting the 13th tooth. And the optimal implantation torque was obtained, and the prosthesis was immediately placed. I will show you the process of securing 40 newtons of torque at the exact location using the Varro guide and the newly released MAXY kit, and the process of making a temporary tooth chair side on the same day using the Magic Eye temp. Let's watch together. After preparing the preoperative guide, we planned IS2 active 4.0 diameter, 13 mm through a dedicated planning program, and planned the sleeve offset to 13.5 mm. With the 14th crown removed and only the root remaining, initial drilling was performed using a prefabricated Varro guide. After drilling, we removed the guide and checked the drilling position, and the drilling was done very accurately in the center of the remaining teeth, exactly as planned. After that, drilling was performed sequentially using the 2.2, 3.0, and 3.5 drill. Now, the residual root should be removed gingivally, leaving it at the level of the alveolar bone or 1 to 1.5 mm above. At this time, there should be no lesions around the residual root for the socket shield technique. Using the master kit, additional drilling was performed up to the final drill to fit 13 mm. To create threads optimized for the implant fixture, the newly released MAXY kit was used to pre-tap the inner tooth wall with a MAXY drill of the same size as the implant. Although the lingual side is scheduled to be extracted, it is very important to perform pre-tapping without removing the lingual root to prevent it from being pushed during tapping. The MAXY drill is used manually and is pushed in slowly while checking the depth. It is better to do it by hand because it goes in exactly where it was drilled. To place the implant a little deeper, I aligned it with the second line marked on the MAXY drill, which is 13 mm, because smooth blood supply and osseointegration were required. The remaining lateral root was cut with a surgical burr and extraction was performed. I manually placed IS2 active implant 4.0 diameter 30 mm length. When pre-tapping has been done, you can use a handpiece, but it is better to place an implant manually so that you can feel the bone threads with your hands. Turn it slowly, check the depth and torque using a torque wrench, and place it to the desired depth. Using the socket shield technique, we obtained a fixation force at 3 points, D113 CMI, and obtained an insertion torque of 40 newtons. Since we achieved sufficient fixation in the CMI area D113 and a fixation force of 40 Newton, we decided to immediately place a provisional prosthesis using Magic Eye temp, as it met the immediate loading condition. After checking the size and shape using a trial dummy, I chose a medium-sized Magic Eye temp. The advantage of trial dummies is that you can check the actual product before opening it. After locking the screw of the Magic Eye temp, I used my hands and resin instruments to adjust its shape to the surrounding teeth while it was still soft and had not hardened. It is easy to manipulate because the shape can be modified by adding flow resin or composite resin used in dental clinic as needed. After sufficiently curing the Magic Eye temp for more than 10 seconds with a light curing unit, trim using a high handpiece and diamond burr and check and adjust the occlusion. Since Magic Eye temp is a high-strength resin, it is faster and better to adjust it with a diamond burr at high speed, rather than using a denture burr at low speed. Since the initial fixation force at the time of implant placement was 40 Newton, the completed Magic Eye temp was firmly fixed with a final fixation force of 30 Newton. After that, I finished fitting it and filled the screw holes with Teflon tape and resin. When I checked the implant stability on the Magic Eye temp using AnyCheck, the first IST measurement value was 66 and the second IST measurement value was 69. The implant was placed about 3 mm downward, and considering the abutment length connected to the Magic Eye temp, the figure is about 4 to 6 added to the measured value of 69, which is a stable figure of about 73 to 75. Currently, the patient is undergoing periodic observation after completing the implant, and the bone level and surrounding tissues are stably maintained without any signs of inflammation. So far, we have looked at a special case in which tooth extraction and placement in the maxillary canine area were performed simultaneously using the socket shield technique, and an emergence contour was immediately formed using a prosthesis using a Magic Eye temp. Thank you.